All right. How's everyone doing? So, our next speaker is the founder of Woebot Health, the mental health ally for people and businesses that's answering the skyrocketing need for mental health care by breaking down the systemic constraints that block equal access to it. The relational agent Woebot is at the heart of an AI-powered platform that can tailor products to specific intended users and patient populations. Our next guest was named to the 2023 Time 100 AI list, recognizing the 100 most influential individuals in advancing artificial intelligence. Please join me in welcoming Dr. Alison Darcy to the stage. And joining her and hosting this fireside chat is CC Obi-Gwacham, a first-year MBA student at MIT and a VP of content for the MIT AI/ML Club. Please give them a round of applause.
All right, testing. Can everyone hear me okay? Yes, all right. Welcome, guys. Welcome, Ali.
Thank you.
I am so excited for this fireside chat with Ali. It's one of the few healthcare topics we have today. And it's also, not so technical in nature. It's a little bit lighter content-wise. So if your brain works like mine, this will be a nice 25-minute break from a lot of the quite technical discussion. I'm CC. I'm a first year here at Sloan. And yeah, I spent almost a decade in health tech before coming here. So, I'm really, really excited for this chat with Ali. Ashwin kindly covered some of her introduction. So I'll just say, I first learned about Ali a few months ago, where instead of doing homework, I was kind of procrastinating online, and I was reading the Time AI 100 list of the most influential people in AI. And, for most of the people, I would kind of, read the little description and then go to the next person. But there were a few people who I would kind of spend more time and, dig more deeply because I was quite interested. And Ali was definitely one of those few people, and started to just kind of stalk her on Google and kind of read every article I could find about Woebot Health and Ali. So definitely super excited about this convo. And she's here all the way from Dublin, Ireland. So please let's help me give a warm welcome to Ali.
Thank you so much.
So we'll kind of go chronological. We'll start with the past and how you kind of got started in your career, and we'll kind of move to present. I won't ask you to predict the future, so you're welcome.
Goodness.
But before we go to the start, maybe do you mind giving the audience just a little description on Woebot Health and what you guys do?
Sure. So Woebot Health is a digital therapeutics company. We built Woebot, who is an AI agent that delivers cognitive behavioral therapy for people with anxiety and depression and common mental health problems. I can speak a little bit about why the world needs Woebot, if you like.
Please.
I think there's three main answers to this, right? The first, of course, is just the level of human suffering that we have at the moment. And I could give you all very frightening statistics about the scale of the mental health care crisis, which I know everybody is familiar with. So that's number one. But the second is really about access. And I think a lot of you would be familiar with the problem of access as well. Therapists are hard to find, expensive, therapy is stigmatized. Most people are not, in fact, getting in front of a therapist. But actually, I'd invite you to think about the impact of a lack of access, right? So if you think about, if you are feeling unwell, if you've broken leg, you go see a physician straight away, right? When we think about the problems of access in mental health, there's one study that stands out to me, and I'll ask the audience, how long do you think it is between first onset of symptoms and first getting in front of a clinician? If you see a show of hands, how many people think it's less than a year? 6 months, 8 months? Okay, how many people think it's maybe a year to 2 years? Okay, yeah, significant. 2 to 5 years? It's 11 years. Right, and there's no other health problem that has this kind of an access issue, right? So clearly our system is not working, right? If we're not getting the help that people need in time. So access is really the second piece. The third reason, and probably the reason why I'm here, is that we believe that AI actually has a unique opportunity in the mental health space, particularly as it pertains to cognitive behavioral therapy. So I know people think of me as a CBT evangelist. I did actually learn about other models in my career, but CBT works really well for digital translation. Most people up until Woebot were doing a lot of teaching with CBT. So that's why they would build apps that kind of taught you good concepts, about sort of good mental health promotion. What we did really differently, why conversation is fundamentally different, is that it could enter into a process with someone, like a really good CBT-based process. And how many of you are actually familiar with cognitive behavioral therapy? You can just have a show of hands. So, okay, so it's based on the idea of your thoughts, and it's not just events by themselves that create our mood problems. It's actually how we're interpreting those events. It's how we internalize. And so it looks at thoughts. And fundamentally, it looks at language as a proxy for thinking. And when you look at, I love to go to the sort of original source for things, right? The like first principles. And when you look at the manual that was created by Aaron Beck, who really created this model, fundamentally shifting our field away from the sort of psychodynamic analysis of dreams in your early life and so on, to something that was evidence-based, data-driven, time-limited. Aaron Beck, in his treatment manual, suggests that therapists should go do home visits with their patients, right? So that they could be by their patient's side as they're confronted with the day-to-day things that spark their negative thought process and, maladaptive kind of behaviors and so on, so that they could help, coach them through it live in real time. Now, how many therapists are really doing home visits, right? All of our amazing clinicians don't have any time. This is a major problem. But that's the unique role that a Woebot can have, right? Woebot can be there by your side at 2 a.m. or in the morning when you're really struggling to get out of bed. Those moments, they're the most difficult for people to reach out for help, but they're also the most clinically potent moments in which we can deliver help. And so that's the role that Woebot has. That's why I think we need Woebot.
Man, that such a great call to action. We will dig into Woebot and what they're doing more in a few minutes, but I did promise we're going to go chronological. So let's kind of go back a little bit, and let's go way back.
Okay.
And when you were a kid, what did you want to be when you grow up? I mean, I know you started off as a software developer, and then you did clinical research psychology, and now you're an entrepreneur and founder. So that's kind of where this question comes from.
That is such a funny question, because do you know the truth? I wanted to be Indiana Jones. I did. I wanted to be an anthropologist, but yeah, and I would also say, software developer. It's a bit of a generous description of what I used to. My husband would say, "You please don't describe yourself as a software engineer. You were a hacker at best." But yeah, I did. I think my career path has been one of being fundamentally fortunate enough to be able to follow the problem, right, and be curious and engaged in big problems, and then being so fortunate enough to be given opportunities to be able to try and solve those problems. And so that's I did an undergraduate psychology, and then thought I would follow a career path to clinical neuroscience. That's when I taught myself to code and worked in an investment bank in London. Just fun times. And then, but then went back to college, but not to do clinical neuroscience, to sort of work on this early translation of helpful experiences in the real world to digital formats, which was, I guess, really new at the time. And then did a PhD, which is more conventional, did postdoc and work in Stanford, ultimately ended up being faculty there, and for 9 years in Stanford, and then founded the company with Andrew Ng, actually, who I kind of stumbled upon on Canvas, and we just on campus and started collaborating really well. Did a halftime post over in computer science there, and just looking at the potential for AI in healthcare. And founded the company in 2017, and it has been really interesting since.
Yeah, great career journey. I think it's so there's so many students in the audience, and you took a lot of pivots, and it sounds like you were kind of following your interests, and you were following your passions, and you were following problems. But through that path, it can be kind of intimidating to switch from one thing to another, right? So did you have any fears or anxieties as you were saying, let me go from software engineering to clinical research psychology, or let me go from being a professor to founding this company, or
oh yeah. Oh, I'm Irish. All I have is fear and anxiety and guilt. And I don't need a reason. Yeah, of course. And it's so interesting, though. Again, I think what's helped me certainly in those moments is to just focus on the problem, right? Like just take a step back and you see, like, this isn't not really about me and my career path. It's just being so compelled. I'm like a moth to a flame, right? With the big problems, and just being like, I want to be part of that. This is something very difficult. And what's interesting too is like all of the pivots at the time, they don't make sense. I remember my mentor at Stanford saying, like, he's looking at my CV and my publications and all of the things that I was doing on campus, and he's like, can you just choose one story? You need one path for tenure, right? But now looking back, it all makes sense. All of those learnings, all of that exploration has come to how we build Woebot. And that's not just me too. We have a team that are all sort of interdisciplinary within single people too. Our CTO is an incredibly highly trained clinical psychologist before he was an engineer in some of the country's foremost psychology labs. Our VP of engineering used to be an archaeologist. He stole my dream. No.
I love that. They say the dots connect looking backwards. So
they do. They really do.
So maybe we'll do a little bit of technical talk. So Woebot is completely rules-based, as I understand. It's not actually generative, and I think it's designed that way for a very specific reason. Rama, who's one of our kind of distinguished data science and machine learning professors at Sloan, gave a talk in the fall, and he talked about this concept of, one of the things with rules-based systems are that they could be a little bit more brittle, right? You have to code quite a bit. And if you get a unique edge case, it might not be able to handle that edge case quite well. Whereas if you can generate, you can really be much more flexible and maybe, have a better product. So, I'm curious what trade-offs you faced having a rules-based model for Woebot, and why you made the decision, what the implications are, if you can kind of dive into that a little bit.
Absolutely, yeah. So Woebot is rules-based now, because frankly, it mirrors how clinicians kind of think, right? If you go to see a physician, they'll sort of take your temperature. Okay, is this an infection or is it not? Or they look in your ears, look in your throat, because that's guiding a path of investigation to inform what they will do. So this is what we call a sort of expert system. It sort of replicates a lot. So it worked really well for our purpose. However, we don't think Woebot will be rules-based forever. Certainly, and we have been for the last 18 months deeply leaning in to learn about generative models and what the impact might be and how to integrate them in a technical sense. And we'll be publishing a study fairly shortly on actually really interesting study. So we've conducted to date 12 randomized controlled trials looking exclusively at the sort of efficacy and safety of Woebot, and it's very traditional healthcare outcomes research. This study is one of the unique ones where we've looked at the difference between an LLM infused version of Woebot versus an experience based on Woebot as it is today, completely rules-based. But instead of looking at clinical outcomes as the primary outcome, we looked at, well, what's the user experience difference? Do people prefer one or the other? Do they disclose more to one or the other? Like, where are the key benefits from the user point of view? Because we are familiar with the technical challenges and trade-offs. Interestingly, I mean, how many people think the rules-based, I'm doing a lot of surveys, it's audience participation. How many people think that the rules-based Woebot sort of outperformed the generative? And how many people think generative Woebot outperformed the rules-based? It's actually pretty evenly split maybe. So we found no difference. Really, really surprised. When we dug in and looked at, there's definitely qualitative differences. Turns out we found in our experience, generative models, LLMs, as you said, they really are very good at doing empathy. And when I say providing empathy, what they're great at is being able to respond to the long tail or the large surface area of the wild and wonderful ways in which humans describe their experience. When you try and do that with a classifier, you're kind of roughly classifying the kinds of things that you're hearing. You just, if you have an LLM, it enables you to have a lot more precision and a lot more surface area of human experience covered. What we found generative models, LLMs, not so great at is process, right? Because if you think about all of these models are trained to give an answer, to sort of give advice. And we tried so many times, we became experts at prompt engineering, and we could not stop the LLMs from eventually getting sort of tired and just wanted to show how good it was and how expert it was. And it was like, you know what, here's what you should say, and here's what you should think instead. But that's completely undermining of the therapeutic process. You're not supposed to give an answer, right? Your task is to facilitate the other person reaching the answer, because it is in that work wherein the sort of neural networks get reconnected and so on. So a lot of incredible learnings, definite trade-offs. I would say watch this space. It's very interesting, and there's lots of, I think, papers coming out. Our engineering team has written about the ways in which they were able to set up the architecture such that the participants in the study were never directly conversing with an LLM as well. And we used our own algorithms to check the output of the LLM and the human, so that we're always checking for concerning language, and it helps guard against prompts and prompt attacks and so on. But yeah, it's the first of many studies.
Great. I want to kind of maybe dive into proof points for a little bit. Have there been any moments along the Woebot journey where you've seen something or heard something, maybe it was a new product feature that was rolled out, or a memorable customer or user testimonial that made you pause and think, whoa, like this thing really works and it's really helping people?
Absolutely. So many. We're very lucky in that, like, we have a lot of users who email us their personal experience all the time, and yeah, it's interesting. I do think the emails that stand out to me are the ones in which people are sharing how Woebot was there for them at an incredibly difficult moment. And there is one email that stands out to me. It was I think it was around the holidays in 2022, and it was somebody who was in their mid-40s with ALS, end-stage ALS, and they said, I remember, I thought about it through the whole holiday, obviously. They said, thank you for building Woebot. My mobility issues means that I can't necessarily leave the house and what have you, but I'm trying to come to terms with the fact that I'm dying at 46. And they said the words, because of Woebot, I am alive. And I'm just sharing, it was an incredibly startling email to have, but I just think that's the power of being able to be there when someone else has no other option.
Yeah. Thanks for sharing that. So I'm flirting. We talked about this at lunch a little bit. I'm flirting with leaving the healthcare industry and doing something else. And I think part of that comes from, as a young, energetic person, you see all of these companies and products that are growing really quickly and having outsized impact and scaling really fast. And as someone who's interested in cutting edge technology and innovation, it's sometimes hard to find that within healthcare. So, I'm wondering if you've ever experienced this feeling of burnout within, the healthcare industry, either during your time as a researcher or your time as as founder and president of Woebot. And if so, like how that burnout may be compared to, between your time in academia versus, being a founder.
Yeah, it's such a great question. I would say immediately, don't leave us. We need really smart people like you. It is a great question because, healthcare is really hard. And I would say if you took a bunch of healthcare entrepreneurs into the room and you asked them, like, how many of you really knew how hard it was going to be, would they actually have founded the company, And I'm kind of being facetious, but it is true that you kind of almost have to come at those big problems with, youthful energy and, the unflinching belief that things can be different, not just that they should be different, but they are really, really difficult problems. And I would say, I was just talking to my CEO earlier on, and we were just saying the answer is, of course, surround yourself with incredibly smart people that you really like, because that's the thing, right? That's the thing that enables you to get through those difficult pieces.
Great. We could keep going on and on. Quick show of hands. Does anybody have questions that they may want to ask? If not, we'll just keep chatting away. All right. Let's switch to questions. Tej, you wanna start?
Hi, big fan of Woebot. I've been following you all for a while. I've noticed a shift recently in the business model with the focus away from direct to consumer and focusing on partnerships with providers and more. Do you mind speaking to the rationale behind that and kind of the approach to shifting how the business is focused?
Yeah, it's a great question. We were very early on, we realized direct to consumer was probably not the way to go, actually. It still remains true, but I still would have launched there because I think that's the most authentic place to build an experience that people like truly resonate with. And that is so important for mental health, behavioral health, to get the outcomes you need, right? However, I think it's still true that our clinicians, our physicians are ultimately, the people that are still trusted, thankfully. Maybe this will change soon, but no, they're still the most trusted sort of disseminators and gatekeepers of healthcare. And I think that becomes even more important because as we see the democratization of some of these technical approaches, we're going to see a flood of stuff pertaining to have, healthcare claims and benefit. Very few of them are tested, and ultimately we need those expert voices to be able to lead the way. That's why we go to a doctor or a healthcare professional. I think there's a big misperception that Woebot was going to replace therapists, but as you can see from the description of the sort of what I call the architecture of therapy, it's never been about. It's what Woebot does is very different. It's fundamentally complementary to the brilliant clinicians that we have right now, but they need help too because they are also burning out and we just don't have capacity. So I would say the decision to sort of remove open access to Woebot was a continuation of that strategy that was always there rather than a shift. But.
Thank you.
Yeah, we have time for maybe one more question. I think she may beat you to it. I'm sorry.
I'm sorry. I have a question about the robot. I'm wondering, what is the goal of the robot? Like, what do you want to achieve by this robot? And currently, it can like only include the mental health is it possible to also include other chronic disease in the future? Because chronic disease doesn't need to go to hospital very often. It just needs some like detection, intervention.
Yeah, this is a great example, because we think things like chronic health, physical health in general, whether it's, oncology, like these all have emotional health components. And I think we are just beginning to accept that, mental health is a huge part of adherence to the things that keep you healthy, like medication or whatever the other habits are that you need to engage with to get well. So we do see a role for Woebot that's much broader than just mental health problems. And you'll see our roadmap reflect that, I think, in the coming years.
We can do one more question. Yeah.
Thank you for sharing your story, Alison. It's actually a continuation you were talking about, right? Compare like the expert-based robot versus like LLM. Like the results seem to be the same, right? There's a pro and con. So what's the kind of, I'm just curious, what's after that? What they would decide to do? Like is a fusion of both, or what would be recommendation for to make it more effective?
That's a great question. Yeah, look, we think we'll be leveraging more and more LLMs in very specific ways. So part of the study was really to kind of do the study to see what the safety architecture should look like, and to monitor, were there safety events? How many times did the generative AI kind of maybe do something that might cause harm? And the answer is the safety record was incredibly good, actually, because I think that's a testament to our engineers and how they set up the architecture. But I think in terms of future, what is the model? Yeah, the challenge is not going to be to build a great Woebot. It's going to be how to build it and get it regulated, get it under, right? We don't really know what the kind of sensible regulation path looks like yet. To get it under all of the technical healthcare certifications that exist, but that weren't invented, that weren't developed during a time of generative AI. These are interesting sort of emerging questions. That's going to be the challenge. How do you really get it adopted by healthcare systems? And so I think big, hairy problems for which we need people like CC to come and solve.
All right. Well, with that, thank you to the leaders of the AI/ML Club for giving us the space. Thanks to the audience for the questions, and Ali, thank you so much for coming here.
Thank you so much for having me. It was great.